CEMIG London, or Centre for Endometriosis and Minimally Invasive Gynaecology at the Lister Hospital, is really bringing together all the expertise that is needed to look after women with the most complex forms of endometriosis. These experts, when working in an environment like the Lister Hospital, where the technology and the infrastructure is provided, can really do wonders to look after patients who have been suffering from endometriosis for years and sometimes are referred to us with the most complex situations when endometriosis has involved multiple organs. So we have the lady from Singapore who is having a big op today. Procedure is going to be excision of diaphragmatic and potentially pleural endometriosis, and then we will probably need to do either a transanal discoid excision or a segmental bowel resection. Today's operation is going to be done by 3 different specialists using the Vinci robot. Endometriosis surgery, which will be myself, and we have Mr. Karim, who's a colorectal surgeon, and then Mr. Andrea Bile, who's a thoracic surgeon. When Mr. Bile is operating, we are seeing what's going on, and we can draw on the screen, we can show each other where we think might be the disease. So we're going to make sure that we don't leave any stone unturned, and now that we're in there, we're going to make sure that we excise and remove whatever even remotely looks abnormal. The robotic technology has given us that extra level of precision and versatility when we deal with very complex endometriosis. We can make finer movements, we can see better, we can have better magnification. Of course, it's the surgeon who's doing the operation. The robot is just a tool, but a very useful tool. It's not necessary in everyone, but in some more complex cases, it really gives us that extra level of precision that we can find helpful. The Lister Hospital is part of the HCA UK network, which includes other excellent facilities: Harley Street Clinic, the Portlands, Wellington, London Bridge. And that means that some of the experts that we work with may not necessarily be based at the Lister Hospital, but we still have access to them and to their expertise. That gives us the flexibility to choose the best person for the job, depending on what the patient needs. We're very lucky that we are in a beautiful part of London, in Chelsea, by the river. To me, when a patient is in the hospital, they're like my guests, so I want them to be looked after best way possible. They need to have the right comfort, because as you're recovering from a very complex surgery, you really need to be looked after well. You need to have the right nursing care. And I think all of these are the pieces that, if put together right, can give the patient the best experience possible.